Hey there, if you enjoy reading more than watching a lengthy video like this, I've got you covered. I've summarized the content of this video on my website. Check out the article link provided below in the comments and description. Just click on it and start reading at your convenience. Welcome to my YouTube channel. I'm excited to dive into the fascinating world of nutrition and its impact on our health. In this series of videos, we'll be exploring various dietary factors that may help alleviate common health issues, starting with the role of omega-3 fatty acids in reducing gastritis inflammation. Gastritis, a condition characterized by inflammation of the stomach lining, can cause discomfort and disrupt our daily lives. While research is ongoing and findings are not yet conclusive, there is growing evidence suggesting that omega-3 fatty acids could potentially play a part in reducing gastritis-related inflammation. Throughout this series, we'll delve into the potential mechanisms by which omega-3 fatty acids may help mitigate gastritis inflammation. We'll explore their anti-inflammatory properties, their influence on the immune response, and their ability to protect and repair the gastric mucosa. 1. Anti-inflammatory effects. Omega-3 fatty acids, specifically eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA, have been shown to have anti-inflammatory effects. These fatty acids are primarily found in fatty fish like salmon, mackerel, and sardines, as well as in certain plant sources like flax seeds and walnuts. Inflammation is a natural immune response that helps the body fight against infection and injury. However, excessive or chronic inflammation can contribute to various health conditions, including gastritis, which is the inflammation of the stomach lining. Omega-3 fatty acids can modulate the inflammatory response by inhibiting the production of pro-inflammatory molecules, such as cytokines and eicosanoids. Cytokines are signaling molecules involved in immune responses, while eicosanoids are hormone-like substances derived from fatty acids that play a role in inflammation. EPA and DHA can interfere with the production of specific cytokines that promote inflammation, such as interleukin-1, IL-1, interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-alpha. By reducing the levels of these pro-inflammatory cytokines, omega-3 fatty acids help dampen the overall inflammatory response. Moreover, omega-3 fatty acids can also affect the production of eicosanoids. They compete with another type of fatty acid, arachidonic acid, which is a precursor for the synthesis of pro-inflammatory eicosanoids like prostaglandins and leukotrienes. By increasing the levels of EPA and DHA, which have less pro-inflammatory potential, the production of these pro-inflammatory eicosanoids can be reduced. Overall, the anti-inflammatory properties of omega-3 fatty acids, particularly EPA and DHA, make them potentially beneficial in managing conditions associated with inflammation, including gastritis. However, it's important to note that dietary modifications alone may not be sufficient for treating gastritis or other inflammatory conditions, and medical advice should be sought for appropriate management. 2. Modulation of immune response. Omega-3 fatty acids can indeed modulate the immune response, promoting a balanced and well-regulated immune system. This modulation can have beneficial effects in mitigating inflammation associated with conditions like gastritis. The immune system plays a critical role in the body's defense against pathogens and the regulation of inflammation. Omega-3 fatty acids, particularly EPA and DHA, can influence immune cell function and the production of signaling molecules involved in the immune response. One way omega-3 fatty acids modulate the immune response is by reducing the production of inflammatory molecules. As mentioned earlier, EPA and DHA can inhibit the synthesis of pro-inflammatory cytokines, such as interleukin-1, IL-1, interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-alpha. By suppressing the production of these cytokines, omega-3 fatty acids help prevent excessive inflammation and promote a more balanced immune response. Furthermore, omega-3 fatty acids can promote the resolution of inflammation. Inflammation is a complex process that involves both initiation and resolution phases. Omega-3 fatty acids can enhance the resolution phase by promoting the production of specialized pro-resolving mediators, SPMs, such as resolvins and protectants. These SPMs actively dampen inflammation and help restore tissue homeostasis by reducing the recruitment and activation of immune cells and promoting tissue repair. In the context of gastritis, omega-3 fatty acids modulation of the immune response can help mitigate the inflammation associated with the condition. By reducing the production of inflammatory molecules and enhancing the resolution of inflammation, omega-3 fatty acids contribute to a more balanced and controlled immune response. It's worth noting that while omega-3 fatty acids can be beneficial in promoting immune balance and reducing inflammation, they should not be considered a standalone treatment for gastritis or any other medical condition. Medical advice and appropriate management should be sought for the treatment of gastritis or any other health condition. 3. Protection of gastric mucosa. Omega-3 fatty acids have shown potential in protecting the gastric mucosa and supporting its integrity, which can be beneficial in reducing inflammation associated with gastritis. The gastric mucosa is the inner lining of the stomach that acts as a barrier between the stomach and its acidic contents. Gastritis involves inflammation of this mucosal layer, which can result in damage and compromise the barrier function. Omega-3 fatty acids, particularly EPA and DHA, have been studied for their protective effects on the gastric mucosa. Research suggests that omega-3 fatty acids can enhance the defense mechanisms of the gastric mucosa. They have been shown to stimulate the production of mucus, which forms a protective layer over the gastric mucosa and helps prevent damage from stomach acid and other irritants. By promoting mucus production, omega-3 fatty acids can support the integrity of the gastric mucosa and reduce the risk of inflammation. Moreover, omega-3 fatty acids have been found to increase the secretion of bicarbonate, a substance that neutralizes stomach acid. This increased bicarbonate production can help maintain the proper pH balance in the stomach, further protecting the gastric mucosa from acid-induced damage. Additionally, omega-3 fatty acids possess anti-ulcer properties. They can inhibit the formation of gastric ulcers and promote the healing of existing ulcers. This may be attributed to their anti-inflammatory effects and their ability to enhance tissue repair processes. By promoting the integrity of the gastric mucosa, enhancing mucus production, increasing bicarbonate secretion, and aiding in ulcer healing, omega-3 fatty acids can potentially reduce the inflammation associated with gastritis and support the healing process. It's important to note that while omega-3 fatty acids may offer some protection to the gastric mucosa, they should not replace medical treatment or management strategies for gastritis. It is always advisable to consult with a healthcare professional for proper diagnosis and guidance regarding the treatment of gastritis or any other health condition. 4. Increased production of anti-inflammatory molecules. Omega-3 fatty acids, specifically EPA and DHA, can stimulate the production of specialized pro-resolving mediators, SPMs, such as resolvins and protectins. These SPMs actively work to resolve inflammation and promote the restoration of tissue homeostasis. When inflammation occurs, the body initiates a series of processes to resolve and repair the affected tissues. SPMs play a crucial role in these resolution processes by dampening inflammation, promoting the clearance of inflammatory cells, and facilitating tissue repair. Omega-3 fatty acids serve as precursors for the synthesis of resolvins and protectins. They are enzymatically converted into these SPMs, which exert potent anti-inflammatory and pro-resolving effects. Resolvins, as the name suggests, help resolve inflammation by inhibiting the production of pro-inflammatory cytokines, reducing the recruitment and activation of immune cells, and promoting the clearance of cellular debris. They also contribute to tissue repair processes by stimulating the production of anti-inflammatory molecules and growth factors. Protectins have similar anti-inflammatory and pro-resolving properties. They can suppress the production of pro-inflammatory cytokines and chemokines, inhibit the activation of immune cells, and enhance tissue repair processes by promoting cell survival and reducing oxidative stress. By promoting the synthesis of these anti-inflammatory molecules, omega-3 fatty acids contribute to the resolution of inflammation and can help reduce gastritis-related inflammation. This can be beneficial in managing the symptoms and progression of gastritis. It's important to note that the production of SPMs from omega-3 fatty acids requires specific enzymatic reactions, and factors such as diet, overall health status, and genetic variations can influence their synthesis. Therefore, individual responses to omega-3 fatty acids may vary. As always, it is recommended to consult with a healthcare professional for personalized advice and treatment options for gastritis or any other health condition. 5. Synergistic effects with other treatments. There is evidence to suggest that omega-3 fatty acids can have synergistic effects when combined with other treatments for gastritis, such as proton pump inhibitors, PPIs. Proton pump inhibitors are commonly prescribed medications for the treatment of gastritis and other acid-related disorders. They work by reducing the production of stomach acid, which can help alleviate symptoms and promote healing of the gastric mucosa. Several studies have investigated the potential synergistic effects of combining omega-3 fatty acids with PPIs. Research has shown that omega-3 supplementation, in addition to PPI therapy, can enhance the therapeutic effects of PPIs in reducing inflammation and promoting healing of the gastric mucosa. For example, a study published in the journal Gut in 2012 examined the effects of combining omega-3 fatty acids, specifically EPA, with PPI therapy in patients with Helicobacter pylori-associated gastritis. The study found that the combination therapy resulted in a more significant reduction in inflammatory markers and improved healing of the gastric mucosa compared to PPI therapy alone. The exact mechanisms behind the synergistic effects of omega-3 fatty acids and PPIs are not fully understood. However, it is believed that the anti-inflammatory properties of omega-3 fatty acids, along with their ability to enhance tissue repair and mucosal integrity, can complement the effects of PPIs in reducing inflammation and promoting healing. It's important to note that while combining omega-3 supplementation with standard medical therapies like PPIs may provide additional benefits, it's always recommended to consult with a healthcare professional for personalized advice and to determine the most appropriate treatment approach for gastritis or any other health condition. Thank you for joining me on this exploration of the role of omega-3 fatty acids in reducing gastritis inflammation. I hope you found this video informative and gained some valuable insights. Remember, while omega-3 fatty acids show promise in reducing inflammation associated with gastritis, it's essential to consult with a healthcare professional before making any dietary changes or starting any supplementation. If you enjoyed this video, please give it a thumbs up and consider subscribing to my channel for more educational content on nutrition and health. Don't forget to hit the notification bell so you won't miss any future videos.